Hello and welcome. I'm Rahab Church and you're watching the Trey Hart Learning Channel. So today we're going to continue our discussion on the medications used in heart failure. So let's start with a story. A long time ago, there were cavemen. To eat, the caveman had to hunt. Now, hunting for the caveman could be a very dangerous occupation. Sometimes they were the ones being hunted, and this often led to many times where the caveman would be wounded. Then when the caveman wasn't hunting, he was defending his home. Generally, this would be against other cavemen. So this also had frequent occurrences of him being injured and often resulted in great losses of blood. Fortunately for the caveman, his body had a coping mechanism which allowed him to live on. Now, this coping mechanism is what in the medical field is called RAAS, R-A-A-S. Now, what is RAAS? Well, RAAS is a medical abbreviation for the renin-angiotensin-aldosterone system. Now, if you recall, in one of the previous discussions, I talked about how the heart will work harder to get rid of the body fluids, but it never seems to get rid of them. So you might now be asking yourself, what does this have to do with the caveman story? Well, in this story, the caveman was injured, and this injury often caused him to lose blood. Well, the RAAS system is what helped him cope until the blood stores were built up. So this is what happens. Typically, when a person loses blood, the body recognizes this. First off, the liver releases angiotensinogen, which goes to the kidneys and releases renin, which combines with the angiotensinogen to become angiotensin 1. Now, this goes to the lungs, and the lungs converts this into angiotensin 2, which then goes to the adrenal glands, and the adrenal glands convert it to aldosterones, which cause the kidneys to start retaining fluid and causes the arteries to vasoconstrict, maintaining the blood pressure. What this is a very complicated way of saying that the body holds on to fluids and maintains the blood pressure until the blood volume can be built up again, and then after this, it returns to normal. So, in the person with heart failure, the body recognizes that things are not normal. For instance, the damage to the heart from a heart attack. The body recognizes that the heart is not maintaining the blood pressure the way it used to. So, the body tries to compensate. And the way it does this is by activating the RAAS system. So, this starts a cascade. In essence, the body starts to think that you are the caveman, and that every day you are in the battle, or you are being attacked by something you have hunted, and you're losing blood. You and I know that this is not happening, but the body doesn't. So it tries to compensate. This is, as we've discussed before in other videos, does not work. So this is where the two classes of drugs I'm going to talk about today come in. The first being angiotensin converting enzyme inhibitors, or ACE inhibitors, and the second being angiotensin receptor blockers, or ARBS. Now, both of these medications work in the RAS system, or they work in the renin, angiotensin, aldosterone systems. Now, ACE inhibitors, they include medications such as captopril, solazopril, enalapril, lisinopril, perindopril, ramipril, trandolapril, basically a lot of medications ending in pril. So what ACE inhibitors do? Well, ACE inhibitors stop angiotensin from converting into angiotensin II. So it also makes it easier for the heart to pump blood around the body. So this improves your blood flow to the heart, which can help prevent heart attacks and also help you become more active. The primary thing is it also helps you to live longer. Now, the primary side effects of ACE inhibitors are that they can make you dizzy. They can also cause irritating cough. So, some of the things you should tell your doctor about is if this cough continues, if it's so bothersome that you can't sleep, or if you get an allergic reaction such as swelling in your lips, rash, itching, or any sudden onset of wheezing, or trouble breathing. Now, the doctors will do blood checks on you usually every 6 months, but these could be more frequently if needed. Now, these blood checks will check your kidney function and your potassium levels. So lastly, ACE inhibitors can lower your blood pressure. So because it can lower your blood pressure, it can cause dizziness. One of the things you need to ensure is that you're also following a low salt diet, which involves not taking any salt substitutes, as salt substitutes often contain potassium. And so as well, you should not take potassium unless it has been prescribed for you. Now, ARBS include candesartan, irbesartan, losartan, and valsartan. So these block receptors so that the angiotensin II can't get into these receptors. Thus, it prevents the release of aldosterone. Now, ARBS cause your blood vessels to relax, which allows blood to flow easier through them. So its main side effects, because it causes your blood vessels to relax, is low blood pressure and dizziness. Sometimes ARBS may also cause diarrhea. So if you have any nausea, vomiting, stomach pains, or diarrhea, you should let your doctor know. You should also inform your doctor if you have any signs of an allergic reaction, which might include, the trouble breathing or the swallowing or trouble swallowing. So like the ACE inhibitors, these will require blood tests at least every 6 months to check your kidney functions and look for potassium as well. So more frequent blood tests may be required, especially when first starting either of these medications. So ARBS, like the ACE inhibitors, you should adhere to a low salt diet and avoid taking potassium unless you have been prescribed potassium, that is. So another thing I'm going to talk about today is beta blockers. So beta blockers might include atenolol, bisoprolol, carvedilol, metoprolol, nebivolol, and propranolol. So beta blockers aren't what we're talking about when we talk about medications that affect the renin-angiotensin aldosterone system. Instead, they block the beta receptor cells in your heart. Now you remember the caveman? When any of us start to bleed, the heart pumps faster and harder to maintain our blood pressure. So, as you've already learned from this video, we're not losing blood. That's not really what's happening. But our body is acting like it is. So it starts to pump harder and it starts to pump faster. Beta blockers block the beta cells, which helps the heart beat slower and less forceful. But it also allows better emptying of the heart. So what this means is that your heart is beating slower, not as forceful, but it's still a good amount of blood which is pushed out each heartbeat, which is really what your body needs. So beta blockers do have side effects. Now these side effects include feeling tired, especially when you first start beta blockers or when you're increasing your dose of beta blockers. Beta blockers can be associated with mood swings. If this mood swings happens, it's usually when you start beta blockers. And beta blockers can also be associated with disturbed sleep, diarrhea, impotence, and will sometimes make psoriasis worse. So, always let your doctor know if you become short of breath or have dizziness or fainting, especially after starting beta blockers. Fortunately, no blood checks are required, but you will need to have your blood pressure checked regularly. Now, when discussing these with your healthcare provider will let you know how frequently you need to get your blood pressure checked. Sometimes this might require you buying a little blood pressure set and doing this at home. Now, beta blockers, ACE inhibitors, and ARBS are all examples of medications in which your doctor will usually start you at a low dose and titrate it to a maximum suggested or the maximum tolerated, whatever of this comes first. Now, when it comes to beta blockers, there are some things you need to be aware of. First off, if you're diabetic, beta blockers may change how you react to low blood sugars, meaning you may have a low blood sugar, and because your body acts differently when on beta blockers, you may not know it. So you may not know that your blood sugar is actually low. So your blood sugar needs to be checked more frequently. So as well, for patients that have diuretics, when you start taking beta blockers, your dose of your diuretic may need to be changed in response to that. And lastly, if you have asthma, you might not be able to take beta blockers, as sometimes they will make asthma worse or interfere with some of the asthmatic medications. But this should be decided by your doctor. Okay, You may also remember that the last thing on the renin-angiotensin-aldosterone system is aldosterone. There are aldosterone antagonists. The two most commonly used is aldosterone and spirolactolone. Now, you may remember in one of the previous videos that I included spirolactolone in the diuretic portion of the teaching. While aldosterone and spirolactolone are diuretics, they are what we call potassium-sparing diuretics, which means, unlike the other diuretics, they do not lower your potassium level. So, they both have similar side effects to each other, which include diarrhea and a reduced kidney function. But only spirolactolone can cause breast tenderness and slightly enlarged breast in men. And sometimes they may cause testicular shrinkage and impotence in men. So, these, like diuretics, if you're passing less water than you usually would, you need to let your doctor know. And if you are on spirolactolone, male that is, and start to have tender breasts, or your breasts start to enlarge, you will need to let your healthcare provider know. And as always, with any diuretic, if you start to have diarrhea is not necessarily a side effect of diuretics. It makes it worse, though. You will need to let your healthcare provider know. So, and lastly, yes, you will need blood tests. These are initially done every 1 to 4 weeks, and then is stable every 3 to 6 months. Well, thank you for joining me. So next time, we're going to finish our discussion on medications that are used in heart failure. And that'll wrap up our portion on medications. So this is Ray Upchurch, and I'll see you then.